My son Mark was born with Down syndrome and major heart issues. Taking him to the doctor made me feel like a horrible mother and so powerless. Doctors told me that Mark needed to be restrained, that people like him with disabilities need to be restrained for everyone's safety. It was terrorizing him and traumatizing us both. Mark was a happy kid, except for those times when he had to go to the doctor, get his hair cut, and even his nails done. We were harming him by holding him down. We were traumatizing him. We were terrorizing him. Sometimes I even had to lay on him. He would have blood vessels bursting in his face from crying so hard because he was so scared. There were times that I would not take my son Mark to an appointment because of my powerlessness and how it would make him feel. I felt horrible. This is my child. I was making a choice to hurt him either way. Hurting him by restraining him or not having his care done at all. I had enough. I made the decision that we would never hold Mark down again for anything, including life-saving medical procedures. I started researching alternatives, and there was nothing but sedation, and Mark would have to be restrained to have sedation. I created Practice Without Pressure because I knew there had to be a better way.
Practice Without Pressure is a treatment philosophy carefully refined over 20 years that believes every person, regardless of their disability, deserves dignified care free of restraint and sedation. We are thrilled to announce Practice Without Pressure is now a first-of-its-kind online e-learning course.
I took the Practice Without Pressure course so that taking my son to the doctor was not this horrible, traumatic event for Sam or for me. I wasn't sure it would work, but then one day, Sam put his hand on my leg and said, "Mom, it's okay. I've got this." And he went back and had a medical procedure done all by himself. He didn't even need me in the room. And for me, as a mom, not having to restrain my son for medical appointments has completely changed our lives.
If I could go back in time and have the Practice Without Pressure tools for my son Mark when he was a little boy, I would do that in a heartbeat. I truly felt powerless, and my son was powerless. I created Practice Without Pressure to give power to my son, power to Mark, but also power to Becky, power to Sam, and power to you.
Visit powertomark.org today to see how Practice Without Pressure can empower someone in your life with disabilities to finally participate in their own care.